29 people in the United States die every day in motor vehicle crashes because of alcohol-impaired driving. That is one death every 50 minutes.
By the time they graduate from high school, 70% of kids will have drunk alcohol, half will have tried an illegal drug, and about close to that many will have smoked or vaped nicotine. 1 in 5 will have used prescriptions off-label. These numbers are critical because one of the primary factors in developing substance use disorders is early exposure. It's a fact that the majority of people who have a substance use disorder began using before they were 18. For instance, if you start drinking, by 14, you have 7 times the chance of developing an alcohol problem than you would if you had waited until you were 21 or longer.
414,000 adolescents ages 12 through 17 in 2019 had alcohol use disorder. Some factors that can increase the risk for alcohol use disorder is how often they intake alcohol, drinking at an early age, genetics and family history of alcohol problems. If alcohol use disorder is prominent in the family history, there is a 60% chance of it passing on genetically. Mental health conditions and history of trauma can lead people to drink as therapy, but alcohol is no therapy. It is a disease.
But we don't have to stop with a drink or two, do we? So you could have more than one drink, or maybe throw in a little weed, and that would be better. So we can control the delivery of these things. You can only have so many birthdays, right? And you can even take more than just the alcohol and the weed and get really happy. So that seems great, except it's not from the brain's perspective. And the brain will adapt to cause tolerance so that you're not quite as happy, and even eventually enough tolerance that you're really feeling basically normal with your drugs. That adaptation is to maintain the baseline, and that also happens when you take the drugs away, is when you really notice it. So if you're now normal with the drugs, when the drugs are gone, you're on the opposite extreme.
To me, the definition of being an alcoholic is having the urge of drinking every day.
Alcohol use disorder is a chronic brain disorder marked by compulsive drinking, loss of control over alcohol use, and negative emotions when not drinking. It can be mild, moderate, or severe.
Well, I met my husband when he was 18, and he did have financial situations that led to stress, family issues. His lifestyle of living was very stressful, and that led him to starting to drink.
Keep in mind that alcohol abuse is too much, too often, and alcohol dependence is the inability to quit. Alcohol dependence can increase an individual's tolerance, withdrawal syndrome, and unsuccessful attempts to cut down or even quit drinking altogether.
He was a very workaholic person. He provided. He was there with us. He supported us. He was always trying to be strong and hold on. But still, he will have to always have that urge of drinking.
A high-functioning alcoholic is able to carry out daily tasks of living, such as job tasks, hygiene, childcare, paying bills, and even participating in social activities without exhibiting the full range of clinical impairments commonly associated with alcohol use disorders.
His alcoholism affected me emotionally, mentally, and physically. I did not know how to deal with the situation. I did not know what to do. I try to help, I try to be there and support, but it did not help. So he still went on drinking every day.
Alcohol abuse doesn't just affect the person drinking, it affects families and loved ones too. Watching someone you love struggle with a drinking problem can be heartbreaking, painful, and frustrating. Your loved one may be neglecting their responsibilities, getting into financial and legal difficulties, or even mistreating or even abusing you and other family members. Some people have fear, anger, and self-blame because their loved one that is struggling with alcohol addiction. Some people may even be so overwhelmed that they ignore it and pretend that nothing is wrong.
To help a person with alcoholism, the best thing is for them to want to help themselves, look for the right help, and go to a long-term rehab, not just a few months, because people could still relapse just getting that little bit of time. And unfortunately, these days, the rehabs only keep you a certain short-term time and depend on you to go on your own. And I don't feel that that's the way of helping a person, because mentally, if they're not ready, they're going to collapse and continue drinking.
A relapse is when a person returns to using drugs or alcohol after a period of sobriety. Many people recovering from an addiction face a consistently high risk of relapse because chronic substance use can result in certain structural and functional brain alterations that persist well beyond the period that sobriety was first obtained. Relapse is common. So common, in fact, that relapse is often considered one part of lifelong recovery. There are two kinds of relapse. A traditional relapse is when someone makes a conscious decision to drink or use drugs. A free lapse is an accidental relapse that happens when a person unintentionally uses drugs or alcohol. The most common relapse risk factors include exposure to triggers, stress, interpersonal problems, peer pressure, lack of social support, pain due to injuries, accidents, or medical issues, and low self-efficacy. When you ingest alcohol, it blocks chemical signals between brain cells, leading to the common immediate symptoms of intoxication, including impulsive behavior, slurred speech, poor memory, and slowed reflexes. Especially in college students, they call it liquid courage to be able to do things that they normally wouldn't be able to do. If heavy drinking continues to occur, the brain is affected dramatically. Not only is the brain being damaged, over time, excessive alcohol use can lead to the development of chronic diseases and other serious problems, including high blood pressure, heart disease, stroke, liver disease, digestive problems, cancer of the breast, cancer of the mouth, the throat, esophagus, voice box, liver, your colon, and rectum. Even your immune system can be weakened, increasing the chances of getting sick.
He tried to get help once and relapsed right away, and he continued drinking. And unfortunately, on January 21st of 2021, he passed because of the situation of alcoholism. All his system and organs were malfunctioning.
I know my father woke up every day wanting to be better for me and my siblings. But the problem with that was he only wanted to heal for us, and he loved us more than he loved himself. No one gets sober unless they want to. According to the National Institute on Alcohol Abuse and Alcoholism, 95,000 people in the U.S. each year die from alcohol-related causes. Unfortunately, my father is a part of that statistic. He passed at 50 years old, and the average life expectancy for men who abuse alcohol ranges from 47 to 53 years old, and for women it is 50 to 58 years old. When individuals try to stop drinking, unpleasant outcomes such as tremors, sweating, depression, anxiety can occur, but the worst of them all is delirium tremors. Delirium tremors can be treated in a facility, but if left untreated, it can be fatal. Medical issues like organ failure can arise because the body has no strength to continue to live anymore, with only life support to keep them going. The prevalence of the college students who drink is 52.5%. 33% of college students binge drink, and 8.2% of full-time college students ages 18 through 22 use alcohol heavily. Alcohol is a factor in the deaths of thousands of people aged 18 to 22 every year in the United States. 1,519 college students die from alcohol-related unintentional injuries. 1 in 5 women experience sexual assault in college. A majority of sexual assaults in college involve alcohol or other substances. Individuals younger than 21 in the United States die from alcohol overdose, falls, burns, drowning, and suicide. You are strong. You are believed in. Don't let the alcohol consume you. Change your path. You can do it.
I can only reach you